Bonsoir, Dr. Agnes.
Bonsoir, Charlotte.
Welcome to the Dr. Roze Biohealth podcast. Very, very happy to have you here with me this evening.
Thank you, Charlotte.
Dr. Agnes Roze is our specialist pediatric doctor from France, and I'm delighted to have this topic with you.
Thank you, Charlotte.
The topic is going to be fair care for children.
Yes, it's a topic that's very dear to my heart. And I'm very happy that we've been having this program for a few years already to help people in need and the one who can't afford proper dental care. And for me, especially for children, it's even a subject that is very close to my heart because I'm a pediatric dentist. I'm a mom as well. So everything touching children. And if I can help in any way, I know how important it is for a child to have a healthy smile. It's a super good start in life.
Definitely, yeah.
So whatever we can do to help the one that can't benefit the dental care, I think it's important we play our role.
Yes, I 100% agree. But talk me through the process of children's dentistry. Like, why is the oral health of children from early ages, from 1 to 16 years, why is it so important that we?
I know that people misbelieve usually that because they have baby teeth, it's not so important because the baby teeth are going to fall and they're going to be replaced by permanent teeth, but they actually play an essential role in it for the children.
So why are they so important?
It starts from baby's life. The first teeth, when they come in, they're important because they will allow your child and your baby to chew the food properly. And if you chew the food properly, then you digest the food properly. If you have healthy teeth as well, it means you have access to different type of food, different type of textures. For example, imagine if a little child has a cavity, that it means he cannot chew properly on one side, maybe because it's painful. So he will switch to soft food, won't be able to eat hard food. And chewing for a baby is really important as well, because it's going to help the muscles of the face to develop. And it's going to bring help the growth of the jaw, the growth of all the orofacial spheres. So it's really important that they have, healthy teeth to be able first to chew. Then it plays a big role as well for the speech, because of course the teeth will help the tongue find the right position. And then after, it's really important as well for self-confidence. I think as an adult, we know it. As a child, sometimes they don't realize it, but soon enough they will realize. And it's important that they can smile, that they feel confident with their smile. So if the self-esteem is slowly starting to kick in as well. So it's really important to take care of them. And the last thing, it's as well a guide. The baby tooth is a guide for the permanent teeth. So it's really important that you keep that guide in the mouth because it's going to help the permanent tooth to grow the right way and in the right position. So even so, they're not meant to last for a long, long time. It's still important to take super good care of them.
Yeah, because I do think a lot of parents do feel, oh, they're going to fall out soon. So, is it worth treating them at such an early age? But
it's really important.
Sense.
Yeah. Especially, they're going to fall soon, but still you can keep some baby teeth until 11, 12 years
That's
old.
Crazy.
So it's quite a long time for certain baby teeth. And it's good to as well have, I would say, good oral hygiene habits since a young age as well, because it helps them. And then later on, I would say, you have the trial on the baby teeth to keep them healthy, and then you're ready for the permanent teeth and to keep them strong for all your life, because these ones, you're going to keep them for life.
So, Doctor, how do we maintain our oral health from such an early age, and what would you advise parents to do for their children?
I would say when the first baby tooth comes, just give a small toothbrush to your child just to play with. Don't force them to brush or anything. It's more like a toy, and being able to chew on the toothbrush, especially when they're teething. They like to put pressure on something, they like to, really chew on something hard because it's just going to help and relieve the pressure of the teething. So just give them a toothbrush to play during the bath, chew on it. The more they chew on it, the more it's going to stimulate the saliva, and it will as well mechanically cleanse the teeth. And try to make it like playful. You know that children love to imitate. So brush your teeth in front of your children and even your babies. And, just to show them that it's something important. So do it at first once a day in the evening and slowly introduce the second time. But don't try to force them too much. So early habits, I would say.
Yeah,
and
lead in by example.
Exactly. That's usually what works the best. Especially when they're young. So
when you would recommend these habits, like what age would you recommend your child to see the doctor, the dentist?
I would say when the first tooth comes in, try to bring your child to the dentist. It's not mainly for a dental consultation, but I would say it's more for a discussion about...
Just to familiarize themselves with the clinic, with the doctor.
Yeah, and it's for more as well for parents to ask questions, because especially nowadays we wonder what toothpaste should they use, what kind of toothbrush should they do. Is it better if they use a pacifier, or what do I do if they suck their thumb? When should we introduce that type of food? Is it, if something looks weird in their mouth, what can we do? How can we help with the teething? I mean, there's lots of questions, especially as newly parents you can have, that it's nice to just pop in once and discuss all this. So it's not going to be, don't worry, parents. It's not going to be about forcing your child on the chair like a baby of 7 months old and try to look in his mouth. It's really going to be more like a discussion and showing them around a little bit, but mainly a discussion about how to get the good oral hygiene habit, how to brush, what are the challenges you might face, with brushing, or what kind of food we have to be careful with, because some food are considered healthy, like, for example, dates, dry cranberry, grapes, but they're as well sticky and it's going to bring lots of sugar in the mouth. So lots of things like this that we can discuss when you pop in with your child.
And sweets.
And sweets, of course.
Every child loves sweets.
Yeah, no, exactly. That's the biggest challenge, especially that they're very accessible today. So just look, when you go to pay your food at the cashier, then you have all the sweets and chocolates everywhere. So I feel it's difficult for the parents because it's so tempting and it's all around and everywhere. So that's a big challenge. So you need a little bit of rules sometimes.
Doctor, what age range do you see of children then?
So usually from 6 months old, sometime at birth, until 15 years old. Usually when they go and start the braces process with the orthodontist, that's the moment they're usually ready for the general dentist, I would say. But if they're still confident to come in a pediatric room with all the toys and everything, I still have some children
love to see you.
17, 18 years old that I still see, because I've known them since they're young. So I say, okay, now it's university, you can go. It's fine.
That's when they transfer from you to one of our general doctors.
Exactly. Yeah.
So talk me through your consultation. What, like for an older child, like 14 to 16, is there anything different that you ask or check for compared to like a young baby?
Yeah. Compared to the toddler, they're having permanent teeth and everything. So the concern are a tiny bit different. We know they're going to keep them for this for life. So usually, especially with teenagers, we're checking a bit more about their diet, because there's lots of things that they can, parents do behind the parents' back. Yeah. That parents are sometimes not aware. So the fizzy drinks, the sports drinks as well.
Stuff.
All the good stuff that they might hide under their beds or anything. So I'll try to sometimes get their opinion without the parents being around. And then, it's going to be more to reinforce usually the oral hygiene and tell them now, okay, you've got these teeth for life. So you have to really, be cautious and continue on that path and that path. So I would say, And then, of course, if they see the orthodontist, it's going to be more about positioning of the teeth. Healthy smile, all these things. And kids nowadays, and teenagers nowadays are very concerned about the way that their teeth look.
Definitely,
which is compared to 20 years ago, is completely different. Now they really come in asking for braces, whitening when they're 13 or 14 years old. So that's something, for me, and I think, a bit, strange and completely different than what I used to do before.
But it's good.
But that's their generation.
I feel like it's trending now. People care more about their appearance. And
exactly.
I think having a healthy smile, it increases your self-esteem and your confidence. So
it's really important. And it's now as well, we know that it's all connected to the body.
Exactly.
So whatever you have in your mouth that can cause an issue or anything, it's going to have some repercussion on the other organs in the body.
So it's a prevention now.
Exactly. It's really nice to be able to work more on prevention than treatment, I would say. So that's why it's important as well to have people coming in and just discuss how to prevent more than how to cure. Ideally, it should be only
How often
prevention.
would you recommend your patients to see you?
Usually,
would it be the same to an adult, like every 6 months for the checkup?
Yeah, every 6 months for the children. Yeah, definitely. Because there's lots of changes in the mouth. Baby teeth are falling, new one are coming, the mouth is growing, and there's lots of things happening around. So it's important that, to keep an eye and make sure everything is going the right way.
Definitely.
And we're not missing too much time in between appointments so that there's no big surprise when they come in.
Have you had any big surprises?
Yeah, no, sometimes it can happen.
Tell us a story. I'm sure you've got lots.
No, sometimes there are some funny things. And you see a child with 20 perfect teeth and then he comes a year later and you wonder, wow, what's happened?
Wow.
I mean, things are completely destroyed or, because sometimes if they start to, be more independent in a way, then they don't really realize that I can have some impact if they don't brush so regularly. If mummies and daddies are not behind their back, then it's...
So this comes down to their habits and their lifestyle, diet, all the other aspects we look into when we do our biological consultations.
Yeah, exactly. No, and it's nice to be able to offer all these advices and all this treatment or preventive measures to children that usually cannot offer it because they're from a different background or their parents don't have the money to afford this kind of treatment as well. So I feel it's our duty to really be able to offer these kids a chance as well to have healthy teeth and everything. So something, it's really, really important to be able to share our knowledge and share our treatment to the unprivileged people.
And we've had some really successful stories too of patients that have started their journey with you. And now they've got perfect smile. And
and the most funny part I feel, I mean, for me, it's that I have some of the children I've seen like 18 years ago or 17 years ago, and I've got 4 of them that I want to become a dentist and are actually studying dentistry. So I'm like, I didn't scare them too much. It seems like actually it looks like a nice job to do. So that's, I think I'm really not proud of because it has nothing to do with me, but it's more like, I feel like, okay, maybe I transmit. I mean, there's a kind of transmission of knowledge and they're happy to do the same thing. So,
definitely. And they obviously trust you and they value your opinion and they believe in us as a clinic.
Yeah. Because lots of them came back and just did first a few weeks here to see what specialty they like and they stay with us and everything. So it's, it's nice to be able to share all this and, help them as well as a student and not only as little children or adults. So it's a learning process and it's really nice to be able to share it.
And the FAIRCARE program, we open that up to newborn children of all ages.
I would say there's no age limit for 0 to 100 years.
Amazing.
I'll be happy to see a few 100 years as well. But no, there's no age limit at all. I mean, anyone can come and they're more than welcome and we'll be happy to treat them if they cannot afford the dental treatment. It's
amazing.
It's important. It's part of being part of the community and being able to help when you can.
Definitely.
In the field that you can help. Yeah.
Can anyone apply for the FAIRCARE Children's Program?
Yes, anyone can apply. It depends a little bit on what their resources are. So then there's a lady here that's going to get all the details. Shoni, that's going to get all the detail and soon will be on the talk show as well. And and then she will just orientate people to see they should see and how it works and everything so that we're sure that it's the right person who's going to benefit for this.
Definitely.
And So no, they they can feel free to apply anytime. Yeah.
Great.
It's a smooth and easy process and we're happy to help.
Well, thank you so much for joining me on this evening's podcast, Dr. Agnes.
You're more than welcome.
I will be seeing you very soon for our next hot topic. So stay tuned. If you have any questions, feel free to drop us a message on our social media and we will see you on our next podcast.
Thank you very much.